We live in a state that was built on rugged individualism. We live in a state where people have had to be conservative and frugal for the entire history of the state to be able to survive. We live in a state where my neighbors I know, most of them will resist to the very last minute asking for help because they're so fiercely independent. And things like 545, which I would have voted for if the Burt Amendment passed. I voted no because it lacked the informed consent that Greg Burt's amendment would have given it. We just need to keep that in mind where we live. The state of Vermont is unique among the 50 states. And if we don't do what we do inside of this building to maintain that uniqueness, then we lose our identity here in the state. So the other thing is, I'm reminded more than 250 years ago or something, I forgot who exactly in our history, said something about sacrificing our liberty for safety and having none of them. Just keep that in mind. I just want to thank you all so much for coming to the State House today to support Children's Health Day in Vermont. As adults and also as a legislator in service in Vermont, we have a responsibility to ensure that our most vulnerable populations, such as children, are supported in all possible ways and also protected from experimentation and controversial mandates. Mask mandates in schools during COVID were not based on science and did not offer protection for children. Our children struggled with masks on many levels, including experiencing increased bacterial infections, skin rashes, and headaches. Speech delays and impediments due to forced masks use surfaced, and our children are still recovering from this compromise. And we actually heard testimony in, I believe it was GovOps, where that particular instance is still a serious problem that's in need of repair. And the kids are still trying to catch up from that, years later. It was well known that masks did not prevent transmission, and despite the lack of safety data, mask use continued in Vermont, causing academic, communication, and health declines in our children. Moving forward, we must all work to ensure that our children are not placed at risk or experimented on. We must respect parents' rights to make decisions for their children, except in cases of negligence or abuse. With regards to health choice, an individual's right to make private healthcare decisions is a fundamental human right, and I will work to uphold this right while I'm here in office. I will also continue to prevent government overreach in health policy and all areas of legislation. Choices in life are essential for liberty and health. I will work hard to uphold these rights for all Vermonters. I have signed on to many of the bills here in Vermont that strive to guarantee health choice. I appreciate the opportunity to speak, and I'm honored to be here to help secure health choice and prevent mandates for all Vermonters. Thank you.